Welcome to the Nobody Tells You This podcast, where we will be debunking popular health myths, fads, so that you can get fact from fiction and make informed health choices. Join us every month for new episodes. Welcome everybody, welcome back. We have had a little bit of a pause because we promised you a special episode on HRT, and as of last week the new guidelines are out, so this focus is all about hormonal replacement therapy, HRT. So we do work with people on holistic, natural ways in supporting your menopause journey, but we really want to get Veerpal's expertise today specifically on HRT. So if you're interested in that, keep listening. If not, skip and wait until the next episode. Hey V, give us a little lowdown.
Yeah, hello everyone. Thanks for waiting and bearing with us on the special HRT episode. We had so many questions, especially the community workshop I do on the HRT when the documentary was released. Well, that wasn't expected that way it should have been. I don't fully agree with that. And also the guidelines came, which we still skipped a lot of points. But today is all about highlighting the medical aspect of the menopause, the treatment. We are big champions for the holistic, and I always say 80% is still holistic approach, but there is a medical need. The reason when you go to your clinician or a doctor or a healthcare professional, private or NHS, they can't really give you the holistic 80%. They are there for the medical advice and medical medication or other advice support for you. And we're going to touch on everything. Is it only HRT you can have, or any other medication can help you with the symptoms as well? Yeah. Or you need a special referral, and in which cases you need a special referral as well at the same time. Yeah. And I think that's very, very important to know that piece of support is there when you need, and a lot of women do need it, and it does help them as well at the same time.
Yeah. So I think let's put any predispositions, any judgments aside. V has got a really in-depth knowledge on supporting women through menopause. And you might have known, if you've been listening to the podcast, her journey and her specialism started out in mental health. So you can imagine the crossover and why she's so passionate, why we are so passionate. We are both mental health advocates. And within that category of mental well-being comes many different areas of support. And so she's talking from specific experience of women going through being sent to her mental health clinic and identifying that it's more a menopause need. So I really want you to wear that cap of curiosity and intrigue as we dive into this. So we're going to look at what age, who is it relevant for? Is it the same? What types? I mean, I still have so many questions despite doing this work with me. So I'm going to throw in my questions just so that the audience questions that are like mine are all captured. So I guess, yeah, what is menopause?
Okay, menopause is not illness, it's a journey. It's the hormonal journey, the same way we started the period and the same way we're going to end it. And if we remember, when the girls start the period, some struggle a lot with the period issues or some symptoms, especially around the cycle, being very eggy or angry or low or emotional or painful. And the same
Everyone's seen Inside Out 2, haven't they? Come on, hands up. Yes. Inside Out 2 is such a good movie now. They should watch it because it talks about that journey of puberty and the emotions that go with it.
Yeah, we need to make on menopause now.
Yeah, we need an Inside Out menopause.
For menopause now. And it's the same way the woman goes through their menopause. And then some start early, the symptoms, some start late, some will have symptoms, some wouldn't bother at all. It will just happen.
And but no one can avoid it. That's one thing.
No one can avoid it.
You can't hide from it.
Yeah, the journey, every human body goes through that journey. Of the woman is it separate for different reasons as well. And then some will have in between the fertility journey of have been pregnant and giving birth. Some would not have the babies by choice, or they couldn't have it. And it's very important to understand that. And the symptoms start from late 30s. That is for sure.
So V, do some people assume if you've not had children, you don't go through menopause?
No, you still go through menopause because
did some people think that?
Yes, some people think, definitely. Our guidelines are still not there. So first thing a clinician, when the woman go in 45, She may be still struggling through her fertility journey. She was trying for a baby in her 40 and her menopause symptoms are already there. And she doesn't know what is happening to her body. Is it a menopause? And it's not a disability with the body, but it's still she figuring out for a number of reasons. And menopause symptoms are there. And sometimes they think it's not menopause, or they think I will not get menopause. And I would say 50% women, more than 50% women are in denial in their 40s. They're not going through menopause when they are.
Has anyone seen the episode of Luxury Wives in Bollywood? Seema, in that episode. I love it. In season 2, they do an episode of Menopause, V. I was going to literally screen record it and send it to you. And they're talking about menopause, and 3 of the ladies, they're in their 40s. They are talking about understanding that they are, you know, symptomatic. And there's one, and she's like, that's not happening. I don't want it. And I was like, wow, this is such a good conversation. Because
yes, and we should have it.
Yeah, mid-40s, majority of people are starting to.
Yeah, they will. And I am 39, and I put my hands up. I can see the signs are converting to symptoms. My energy is not there. I'm struggling with my energy levels. I did struggle with my hair loss. I just working on it. And my brain fog, memory got impacted big time. And then emotional. I am more emotional than before, and my cycle. I never ever struggle around my cycle with my emotional health. And this is from this year, I started to struggle. And I acknowledge, I know it's the perimenopause started. Someone may laugh at 39, but it's other symptoms are there, but it's the mental health symptoms. My behavior is changing, basically. My body is changing, and I have to accept it.
I also have to emphasize that, so it really hit me. I started my business at 38. 39, it hit me. By 40, my body changed. I'm in the world of nutrition and weight loss, fat loss. So for me, I was like, I don't understand why I teach women fat loss. I teach women to maintain their weight. What is happening? I felt like a fraud. For like 2 years, I then documented it on my page, how many things had happened. And it was very subtle. It was this reoccurring UTI at the same point in my cycle. Then suspected thrush symptoms, but we know that actually it's dry vagina, right? Vaginal dryness.
Yes.
And
remember that? Yeah.
And I'm so glad, like even my mum spoke about it at our menopause event, and it was so liberating to see a woman of an older generation acknowledge that and acknowledge these symptoms. But I then had itchy skin, I had hair loss, and I was like, oh my God, like I felt like my life was falling apart. That you could visibly see on my body. And I was asked by my father-in-law's carer, my mother-in-law was asked, is she pregnant? Because the abdominal weight just all centered on my stomach. So when I say 39 to 40, that was like a really big click. And I didn't get ahead of the curve because I was still not aware if it was that.
Yeah, we are in denial. We are in denial. That's the problem. We are in denial. And by the time, if we don't start to at least understand it, then it can be too late for some women. Some women it's fine, for some women it can be. And another thing which I would like to highlight, I had a consultation with someone, and also a couple of people messaged me. I eat healthy, I do exercise, everything is balanced. What is wrong with me? And there is a missing piece of the instrument to synchronize the hormones, which is missing. And the reason it is it's messing up the balance of hormones. So we need to find the key hormones which are imbalanced, and that's why energy is not there. Our sleep is impacting all over it as well, and then our overall emotional health is impacting. And that's where everyone's struggling these days. Is you need to find where is the rhythm imbalance in your body, and that rhythm has to be balanced to synchronize all the hormones. We got to remember that it's not only the fertility hormones which impact our menopause. It's not only estrogen, progesterone, and testosterone. It's our cortisol level, thyroid. The hormones are 2 types: steroid, non-steroid, peptides, amino acids, and the endocrine system, the insulin resistance, our cortisol, thyroid. They are the important piece of the music band. Like if we're creating a band.
Go and listen to the episode on thyroid. If you haven't done it, go back now, listen to the episode on the thyroid. I think that's really important too. I think it's so good that you've mentioned that.
Yeah, and that's where it balance, and we get wrong. Only eat this food, it will release estrogen in your body, but only estrogen not going to. You need the kick for it to balance everything. And I
Yeah.
always
So you,
say
like you said, it's like a band.
it's like a band.
I
You're
love
furnishing.
that.
Yeah, it's like a band. You're making a music. Look for furnishing a room. You done a room, plastered it. But if you haven't synchronized the color, you can buy expensive sets and put there. But if it's not synchronized with everything, the room gonna look dull. So the things has to have a balance. And same, we got so many hormones, our endocrine, non-endocrine, they need to balance together. And that's where we are going wrong in menopause and perimenopause. That's why we are not focusing. We nothing. We complexing it. We're making it too
More
complex when
complex.
it's not.
Yeah. Oh, I'm so
It's,
glad
it's,
you said
it's
that. It is.
simple. It's simple. It's very simple, but we making it, and everyone will have that individual need for themselves. If something working for me, not necessarily work for you,
Yeah.
Trav.
It's a
So
big
it's
market.
fine.
Yeah,
Yeah,
it's a
it's
big market. It's booming. It's taking money out of people's pockets.
yeah.
Please, a disclaimer. Before buying a sugary, chewy gummy for any health, can we just take a moment to mention that? Before buying a sweetened, sugary gummy for any of your body health, hair,
In
apple cider vinegar,
for
whatever it
collagen
is,
gummy, you sent me the box, and I said, ooh, like you don't need it. Start from
just please
scratch.
don't buy any menopause gummies. Please come
Yeah,
to Veerpal first before buying any menopause gummies. Honestly, it's just,
check them.
I say,
You
turn
rather
around.
don't have.
Is the main ingredient sugar? Put it down. Because actually, what I would say from a nutrition point, in your perimenopause, in your menopause, you don't need extra sugar. I would like you to not add extra sugar that you didn't eat before with gummies. Don't do it.
If anything is too tasty and healthy, they don't go together, basically.
Thank you.
Because especially if we are so nice to have a nice cakes and chocolates and this, you're not going to like any other taste. That is the truth. You're not going to like a healthy taste, because healthy taste is not our taste buds are not adapt to it. We have damaged them by eating all those in our lifespan. If it's too good to be true, it's not too good to be true. If it's like sweet, oh, it's very tasty and yummy, I love to have it every day, it means it's
I
not
know
healthy.
someone who believes that they helped her, and I was like, placebo
No.
effect is also very important.
Very, very, very important. And sometimes we think it's too expensive, it's too like this fancy box, it's nice.
Yeah. And
No.
also, can we just mention that, so before going private, before buying, so this is true. So you've helped us understand what is menopause. Every woman is going to go through it. It is not a disaster zone. It's just a phase of life. It's a natural phase of life.
Yeah.
Women are going to be impacted end of 30s into your 40s. By the time you're in your mid 40s, you're likely to have experienced some symptoms. For some people, it's extreme. For others, it's moderate. And for others, they breeze through it. So now what can you do? Where should you go to look for your remedies if you are having symptoms?
Okay, I will give my example. So let's see myself as case study. I'm 39. So I'm okay managing, okay, because I got knowledge as well and I can help myself. If for example, I am this human body, I have no knowledge of menopause, I have no sport, I don't know what to do, I may have end up with the doctor by now, because I can see my body is struggling, what is wrong with me, and my family identified it. My husband identified why she's tired all the time. Okay, I got thyroid problem, but it's fine, it's manageable. So when the symptoms get too worse, mostly symptoms when a woman, I'm not gonna lie, they struggle is obviously hot flushes, we say, cold sweats, hot flushes. That's the main visible symptoms you feel yourself. Yeah. But the other symptoms is you don't feel yourself. I am not the same woman. When you identify to yourself, I'm tired all the time. I can't wake up in the morning. Why I sit on the settee, I'm tired. I am not doing all the tasks what I used to do. Like my house look like a wreck. I'm tired and wired. That's the example I would say. I'm tired and I'm wired all the time. I get angry. I get stressed. My heart is
coming. Be the name of this episode: tired and wired.
And my heart is coming. My heart is coming out of mouth. It's coming out of my chest or mouth. That's why I'm feeling like. Yeah. And that's brain focus is like the appointment deadlines you missed for your children, for your family, for yourself. That means you're drowning. It's not the workload, it's your body is giving. That's
I had less things happening in my life. I pulled back a bit from the business. I wasn't working in any job outside of home, and I still felt tired and wired. And yeah,
Yes.
your partner and your loved ones are going to bring it up. They're going to be the ones that are like, what is wrong with you? You're going to see it in your marriage, and you're going to see it in your children's
In your
relationship.
relationships, everything you're going to see, and you will be more emotional and cry.
Libido, yeah.
Yes.
And I
Libido.
remember what you said at that talk was, yeah, God, why is she such a bitch when your friends are thinking like,
Yes, that's what you will see. And you tend to hate everyone. That's how you feel very lonely. You feel lonely, even you know your loved one, you feel no one loves me, no one cares. And that's the feeling you're getting. And then the physical symptoms of hot flushes, the cold flushes, night sweats, vaginal dryness comes. Some have, some don't. Loss of libido, some have, some don't. And then again, you have other symptoms. Weight gain, obviously. Not weight gain, I say 10% lose weight, women as well.
yeah, we knew that. We knew someone. We knew Jay, who
Yeah,
talked about her journey with you. Yeah.
yeah, yeah. So that's one another sign. So that's the physical. When you're thinking you are changing, basically go appointment with your doctor. And when a woman come to my clinic, so she said, I don't know what's wrong with me. Or sometimes they booked in my mental health clinic. Any woman in 40s booked in my mental health clinic with anxiety, stress, low mood, emotional, I move them to menopause without questions asked. I know she is no mental health patient. And then, so that has happened. And then we do blood test. The reason blood test, as I said, estrogen, progesterone is not only the measure of your menopause. It's so many symptoms play an equal role. And that's why sometimes you could be on HRT, but it may not work because other things are not controlled around it. That's the reason.
Yeah.
And so the reason I do the blood test is to check something else is not going wrong in your body. Is vitamin D, which cause you depression, low mood, and anxiety,
Yes.
and tiredness. Iron deficiency.
Can we do a quick reminder, everybody that's brown, anyone, please take vitamin D regularly. Don't wait for a blood test. Us as brown South Asians, we need our vitamin D all year round. Just saying.
All year round. Yes. And iron profile is not low. If it's low, then again the same symptoms can happen. And thyroid is not abnormal. If that happens, sometimes you never had thyroid problem. Suddenly your endocrine system mess up, and then your thyroid will go abnormal. So once I'm satisfied, are they normal or abnormal? We made a plan for that. According to that, then it comes to the other symptoms. And when it comes to the other symptoms, so then I always ask the woman, what is the main symptoms you want to get clear on? Because that's the thing. Because what's the main symptom affecting your life? Or if you want to walk out of the surgery, what you think, if today someone take this away, you can feel a bit normal and back to yourself. And then normally women give 2 to 3 symptoms.
Yeah.
If it's hot flushes, cold flushes, or this, it's my duty to let them know it is menopause changing, and that's why it's happening. Obviously, I give them holistic approach as well. You need to work on your diet. Your body is not the same. What exercise you're doing, any stress relieving you're doing, breathing exercise, self-care, what their lifestyle look like, what they do in a day, dehydrated or no. So that's the non-pharmacological approach. We say they're done. Come to the pharmacological approach. Maybe she have attended a workshop, she have watched a podcast like this, or she read something, she's ready to have a HRT. She said, I want some medication, that's it. Just give me something, I want to get rid of these symptoms. And then we make a plan. Obviously, we do consider HRT. And HRT, not every woman can have HRT. We have to check their clinical background.
Okay, yeah. What are the exemptions? I didn't know this. What's the exemption?
If someone have breast cancer, they can't. But it's
okay, this is really important. This came up in the documentary, cancer and HRT. I did not know this.
Yes, they can't. It's not HRT cause cancer. It's just it's not in the guidelines, and we never go against the guideline.
Okay.
But when you are having a medication, go with the open mind. Don't let someone else to make a decision, but make a decision what is important for me at this moment.
Yeah.
Any medication, they have evidence. They've been tried on so many people. As long as they are in a managed dose, they would not harm you. They would never cause damage to your body as long as you know what you're doing. And you have a healthy approach of 80% as well at the same time.
So I think that's really important what you said. Managed dose. And I see people in my NHS health and wellbeing clinics, and I say to them, if they're in their 40s, I would encourage you to look into HRT. Yes. Whatever route you go, you need to listen to your body's response. You need to be reviewing with your practitioner.
Yes.
Not
And
a
very
one dose fix all problems in life, is everything
no,
better.
one dose. And always start from very, very low dose and
Mm.
see the response. If by going to the middle of that product, we don't see any change, then we know we need to switch to something else. We know it's
Yeah.
not working. If we see slight improvement, then we can increase. But never, we never go against the guidelines. The reason it's not like someone told us to follow the guidelines.
Yeah.
It's important to see the body, how long term, we want to make a long term sustainable approach. If, for example, a woman comes to me, I have done a maximum dose, but she's not working on her diet, she's not working on anything else.
Yeah.
80% of life is 20%. We can't keep increasing the dose. That's wrong. But if we know everything else is working fine, it's just for a few months we can increase the dose, then it's different. And then we bring it back down as well at the same time. We have a plan to bring it down.
Now, people
And
got really scared in the panorama around, wow, they maximum dosed it. They gave them really high dose. They gave them really high dose. I want to hear what you've got to say. My simplistic view, while I've been sitting in the background, was they prescribed you a dose of HRT. And we still haven't gone into what it is, but we will. But they prescribed me, for example, 100 milligrams of something. Now, it's my duty to listen to my body and it's responding. So if I go back and they want to give me more and I still don't feel good, and then more, it's the onus is not just on the practitioner.
yes,
We have to take responsibility of an autonomy of our body and understand like how it's affecting us.
Yeah.
And push back as well.
That's the problem with us in modern world, in the Western world, in the medical and well-being. We're relying too much on other people for our health, and we're not taking our own responsibility. And that's where we're going wrong. As I said, someone can come in your house, do everything for you. That's not a long sustainable approach. You do need to take responsibility of your own health. That's where we're going wrong, and we coming into the blame. I paid that much money, it didn't work. I went to my doctor, it didn't work. I did this, it didn't work. This person done wrong. But what responsibility we taking? We could be expert, professional, accountant, solicitor, or doctor. What we could be business people. How we can run other things if we can't run means we have problems in our body, but we need to take responsibility ourselves. It comes both ways. That's why it's a mutual relationship between your practitioner, your healthcare professional, and yourself, and they both need to work together on the same pace to make the results and the symptoms clear. And that's where things go wrong at the same time. And when we go to the HRT, is every medication have leaflet. Always see every manufacturer put the maximum dose they allow people to have. And read the label. What's the maximum dose? Is my doctor or whoever gave me advice? And then question back, hang on a minute, it says this. Why are you giving me this? And then you ask for a second opinion. Always ask for a second opinion. Because,
now that's very important. So I've got a question. So you talked about doses. What are they? What is HRT? Am I taking a gummy? What am I taking?
You're not taking any gummy. We won't allow in NHS these things. Okay, so HRT. HRT is you need basically to balance the two hormones, estrogen and progesterone. When the ovaries shrinks, they stop producing the eggs. When the eggs not producing, they are going to the brain, not producing those hormones. And when they're not producing those hormones, they're less. Our all body's organs start to perform less. Our heart, our digestive system, our endocrine system, everything's, our skin, our hairs, everything just give up on us, basically. So we need to boost it up. Some women really, with their 80% non-pharmacological holistic approach, it really improves. But with some women really, really struggle or something going in the life, they're too busy or stressed, they can't work on. We need to bring them on the baseline.
I've got to give a shout out to somebody. I have to give a shout out to someone. Jay Regani, she was at our menopause health event. And if somebody listening is really determined to avoid HRT, she works with energy and crystals. Just wanted to shout that out.
Yes, and that's very, very important. And your body, as I said, it needs emotional absorption, it needs good nutrition, and bones need exercise. It's the fluids which move in the body, which we can cover in the next episode. And then, okay, we made a decision. We're going to give HRT. We're going to give two types of hormones. A woman which don't have a womb, who had hysterectomy, she only need one hormone, estrogen. A woman who have intact womb, not had hysterectomy, she needs two types of hormone, estrogen and progesterone. Let's talk about estrogen. Estrogen is the main which produced. It comes in different formulation. It normally, we always give the transdermal route. Transdermal route is you apply the gel or a spray or a patch.
That's what it is. So that so it's absorbed.
Topical.
Yeah.
Absorbed through the skin. It gives the equal amount. Some people like the gel. Like I have some clients in my private clinic come, they said they want to try the gel. Okay, gel. Some don't like the gel or prefer applying it and absorb. Well, they said, I'm happy with the patch. They apply a patch. Some don't like patch because they say it's visible or whatever is the reason, or the skin, they get irritation. They go for a gel or a...
If I come to you privately in terms of experimenting with the type versus the NHS?
Yes. A flexibility of the formulation.
Yeah, like say if I work with you privately or NHS and I don't like the gel, will the NHS change it for me and give me?
Yeah, we do. Yeah, we always, so first time we never prescribe you any medication. We always send you with the information or a video. You watch, you understand. And then if you're ready, you can give a phone consultation. Oh, I'm happy with this. Can you prescribe me this? So we want you to, because that appointment, you can't make a decision and it's wrong for you. We want you to go home and then you can give us an email. Normally in NHS, you just say, so-and-so said, can you issue me this? I would like this. And because we have already made a decision, but it's just a formulation. And then you can change. We always say lowest dose with one formulation you start and you wait. It normally, we always say 8 to 12 weeks to see the effect. Okay?
So I might have to use the gel for 8 weeks?
8 to 12 weeks. Yeah, 2 to 3 months.
What if I hate the gel? Can't I stop after 4?
Oh, if you do, you can stop then. Then you can come to the spray or the patch.
Okay.
Yeah. If you don't like the gel, you say, no, I would like to try that. That's it. But you can't say it's not working because it's not going to work.
So if I don't get on with the gel, you can switch me to another type of the same milligram dose, etc. But I still have to continue using that for the 8 to 12 weeks to ensure that it is actually working. I can't just quit and then start something else.
No, you can't. That's where we go wrong, because we want quick magic wand. There is no magic wand. That's it. If you say come in 4 weeks, oh, it's not working, it's not going to work. It's not going to work from 6 to 8 weeks. After 12 weeks, we review the dose. And that's very important. And then if you say, and then our main job in first 8 to 12 weeks actually to see there is no any side effect. You're well tolerating it. It hasn't caused you any side effect. That's the first. When we give medication, we want to look for side effects first, then we look for benefits.
Are there lots of side effects? And do the side effects not feel like the menopause side effects?
Because it's a hormone, so we want to see any bleeds you had or it tolerated. And sometimes it's placebo. In some women, it just comes from placebo. I just don't like it. So we want to say you have accepted the medication mentally and your body have accepted it as well.
Got it.
Then any medication, it goes, you mentally and physically accepted that medication. See, it's the holistic thing comes to medication.
I really like that. I think that's so
and I always say, first question we say, have you tolerated it well? And then what you have felt different, good and bad.
Yeah.
And then you go for the bad. Then you look for good, what has changed, and always go from what symptoms you came for. Did it help with those symptoms or any other symptoms? A lot of women say, it actually helped with this. And then we say, would you want to increase dose or no? If they're happy with that dose, we leave it. If they say, no, slightly, I could have a little bit more, then we can increase it. And oral tablets are available as well. So the woman can have oral tablet for estrogen as well. Mostly we prefer the transdermal route, and women prefer it as well. They don't like combination of estrogen and progesterone. It come in a patch form as well. Okay. So women who have period or not. Yeah, that's common.
I'd like to hear the listeners' views of which one have you heard of so far. I always thought HRT was patches.
Yeah, patches come in an oral combination tablet as well.
Yeah.
And if it's a separate, some women like to have a combination. I'm done, and which is very good. The reason we prefer the combination is because she take the gel or spray because that's like a little friend to her estrogen, and she forget about progesterone. And it's very important to have a progesterone, otherwise it wouldn't balance. And then because she forgot to take a tablet or anything, and then it causes imbalance. Because we are busy. Women are the most non-compliant with medication.
Right, hold up. We've got to pause on this one. This is really important. Okay, so we are one of the most non-compliant with medication. I thought it would be men. The
We
other
are very
thing, other thing, the importance of the two, that really came out in the Panorama documentary, needing both. I just kept thinking
yes,
estrogen, estrogen, estrogen. Okay, so
it's
just
both.
give us a bit about that.
So
Both
estrogen,
things.
either you have a single, like as a spray gel patch, or you had a combination with the progesterone, or you can have a single estrogen and progesterone as a capsule tablet form, or as coil.
So I think we need to just clarify that on the coil, which is also contraceptive and hormone, you don't have a period. I feel some of us, even in our mid 40s, have got very poor knowledge of contraceptives versus hormones versus
Yes,
menstrual cycle. So yeah, if you're
yes,
on the coil for the progesterone, you don't need contraceptive.
yes,
But then how will you track your cycle? So someone like me, when I'm a nutrition coach, I look at cravings in people's cycle. What would
yes.
you suggest? How can they monitor their body?
Yes, so it's very tricky. And some women stop their periods and they still have all full on menopause symptoms. Or the women who are on some type of coil, they don't have a period. So then I always say, start to monitor your body for 4 weeks because ovulation is still happening, and that's you see the changes, the sore boobs, your mood, everything does changes. Even though you don't have a bleed, but the cycle is still going inside.
Brilliant.
Okay, it's
Yeah,
not bad like you don't have a period, but the cycle is going, and you will. And again, it takes good 3 months to adjust your body according to that. It's not
yeah,
like you had something. Any hormonal rhythm, it takes good 3 minutes months to balance in your body. Look at
yeah,
even pregnancy. The first trimester, 12 weeks, is always to balance everything, and then they look into proper pregnancy. And we
yeah,
forget that. We always forget that it's a body made of blood and flesh and so many neurotransmitters, and that's where we forget and we want quick, quick, quick. Give 12 weeks at least, and then you will see what's happening, and then you observe what's good and bad going, medication wise or non-medication wise, and then make a decision. Then when we throw the towel in 4 weeks and start to blame everyone, that's where we go wrong, and we compromising with our health. And
yeah.
now coming back to, you had the choice of HRT.
I
Obviously,
do want to
when you,
say, so start monitoring your body. Anyone listening who doesn't think that they have symptoms, don't know if they have symptoms, or you do know, start monitoring your body around your present menstrual cycle, or if you're not have a menstrual cycle, still listen into your body. Keep a diary of mood, food, sleep, energy. I just really recommend women get more in touch with the body. Stop putting it to the experts. Stop putting it to the clinicians. You take responsibility to listen to your body and monitor those signals and signs too.
and the parameters which I say you should be checking health checks is your annual blood test, your blood pressure. If you don't suffer from if you're going through stress and anxiety, your blood pressure is changing. So make sure you're checking blood pressure. Not every day, like I was stressed, let me check my blood pressure. It's like your heart rate gonna be above the roof that time when you're swearing and angry. Not that time, but in a relax. At least once a week, every couple of weeks, once a month. At least you need to know the baseline of your blood
You
pressure
can
as it's
do it at the
getting
pharmacy
old.
for free,
Um,
right? In the UK.
yeah, yes, you can, or just buy a machine at home. It's good to have it.
Yeah.
A BMI, very important to check your BMI, your weight. It's not to check, oh, how much I have gained or lost or how much I look slim. It's to see what is changing in your body and
Yeah.
obviously your cycle as well. They are very, very important parameters to check and what's changing in your body. Okay.
Yeah.
And then we go, so we done the HRT. We know you may, for any reason you don't want HRT, you can't have HRT. What is the other medical treatment you can have actually to
Okay.
manage those symptoms? Because it's very important. Okay, I can't have HRT. Okay, you doctor, you're telling me I can't have HRT, so you can't help me. So what's the point of you being my clinician as a menopause?
Yeah.
That's where we need to look for. If someone got period issues, very prolonged heavy bleeds, some women like bigger clots as soon, and
Yeah.
that's we say their menopause is affected by that. It could be number of reasons. Anyone with a prolonged bleed, heavy bleed, the cycle lasts for more than 2 weeks, or it's like having 2 periods in a month, we know the changes have started. We always refer to the gynecologist because it needs to be
Yeah.
looked further. You need a referral on a medication base. If a woman comes, I done the referral for we do a scan, refer to a gynecologist, we give some medication to manage the bleeding symptoms. It's not a treatment, it's just to manage. We give a medication to slow down the bleeding and manage the pain as well. So at least, and then we always give you the iron as well. It's very important if you're having very too prolonged bleed, because you're going to be anemic straight away. So we straight away add the iron in your diet as well. So it's very, very important. You go to the doctor. Like I had one client and she messaged me, she booked consultation. She was bleeding from 4 months and she haven't been even see a doctor. Like more than 2 weeks of bleed. She said, oh, I thought it will calm down. It will never calm down. Bleed is more than regular. You need to get it checked by your, it could be anything.
Don't wait. If it goes past 5 to 7 days and it's heavy and you know, please get it checked.
Yes. And when I checked her iron, she was very extremely anemic, and that was impacting her energy levels and brain fog and everything. So it wasn't like menopause. It was menopause symptoms started only period, but it was other things going on. And then it's gynecologist decision. They check everything and then make a decision what they're going to do. If someone really suffering from hot flushes, night sweats, we have got some medication to manage that as well clinically.
Oh, wow.
Then if someone really suffering with anxiety, emotional sort of symptoms, then we give medications for relaxing the mood, emotional health, and anxiety. Sometimes you don't have any other symptoms. It's just the palpitation and anxiety. Then we can give you beta blocker. And then we observe, does it clear that symptom or not? Because some women may not have any other symptom. It just be 1 or 2. So we target that symptom and give a medication only to observe. Unfortunately, for weight, we don't give anything. Because that's something come from your own. But some women really, as I said, they tried exercise, everything. Then we can put on additional sport, what else is going on as well for them, or they can have any other sport. So this is like pharmacological, but HRT is not only the solution for you.
I've got to add into there
what else is going on as well.
Yeah, you just said something really important, that when somebody has that level of bleeding and it is impacting quality of life, they will be given medication to manage the symptom. It's not a cure. Nobody ever promises a cure with medicine. And I think there's a real conflict with modern science and holistic health. They can work together, because that period non-stop is going to affect the quality of that woman's life. She needs something just to manage that bleed so she can get on with doing what she needs to do to function as normally as she can. And that's when that medicine is really helpful for her. That's really important. It's not a solution, but it's going to help you with your quality of life until they research the cause.
Yes, and it's very important. And that's where we forget, because that bleed, you are bedridden. Like you have a thick towel under you, not like pad towel, like proper like bathing towel, and that will soak in blood, and you walk in and there is a clot. So that's the bleeding you suffer from. And that's where it's like you're given birth. And that's what the bleeding is like. And it's not normal. Obviously, your body going through a change. If we got it's a knock-on effect on your quality of life. And don't suffer with that, because that's something, obviously, that's what the gynecologist for it. Some could be having underlying reason. Some may not be. It's just they need to have a hysterectomy. And then they make a decision what's emergency and what's not emergency. But on a GP level, we give medication to reduce the bleeds as well and stop the bleed and manage the pain. At least you can get on with your day-to-day life. And obviously, you don't go anemic, because very crucial, you don't go anemic in that bleed as well. So this is all about overall medical approach. Obviously, we can have another episode if you ask more questions. We can touch one topic at a time right from here, because otherwise we could be sitting here hours. But it's very important. But we missed breast cancer. We have missed. So NICE guidelines came. Again, it was generic guidelines. They updated after like more than 10 years, 11 years. But breast is still missed on there. What the plan for breast cancer? What's the plan for women who go through early hysterectomy? How we manage their menopause? How we manage endometriosis women's menopause? How we manage women going through fertility issues, their menopause? How we manage women have fibroids and all other issues, their ovarian deficiency? How we manage their menopause is going to happen. This is a phase but how we manage, they are all still missed for all these women who are disabled. Woman, I had a client who booked a call with me. She's a MS patient. And she doesn't know, is it MS symptom or is it menopause symptoms?
Yeah.
And the guidelines are so, and that's something obviously the specialist can help, and we have to make a decision. And it comes in women going through cardiovascular issue. That's how hard menopause would be. So that's where individual decision, what is menopause, what is no, and make a plan for you as well.
So V, what is, because you are a private Harley Street menopause clinician, what is the benefit of a woman coming to you versus her doctor?
Means I still work on the other side in NHS as a doctor, and they come, and my approach is very different. Either I'm working private or NHS, my approach stays the same. It's not like someone paid me direct money and I'm going to look after them more, because it's as a clinician, that's my approach is. Only approach you get more, put them on a journey with me, because they may not get appointment with me again, because that's not my decision to see them again, because that's a practice decision. They get booked. That's what I'm explaining now. So with NHS, the main difference is they don't have a personal tailored approach for them long term.
Yeah.
Because once they book with me NHS, that consultation, after that, I'm not responsible for them, because they may not get a call with me again, because it's not my decision to see them again, because it's a surgery. If they book a call with me, I will see them again, everything. But if someone comes to my private, I don't look for that consultation. That consultation is only one part. I make a plan for them.
Yeah.
It's a plan made for them, tailored and personal, give them a bigger picture, not only for that stage of menopause, the post-menopause stage as well. And then we make a plan how we're going to, it's a goal done for your health and well-being. Look at bigger picture. If one doesn't work, how we can change and tweak. And it's a two-way approach. I can't work in a single way with my clients. We both work as a team together to get the results what we want. And that's the difference with them.
I think it's important to emphasize, because the Panorama documentary might have put people off going to private consultants, but these are isolated cases. Even in my health and wellbeing clinics, if you're booked in and we are allowed to give you 6 sessions, outside of that, that's it. Whereas when you work with either a health coach or a menopause clinician privately, you can go on a longer term journey to really get the results that you're looking for. But also, we are then available as a one-to-one approach, guidance, advice, questions whilst you're on that journey. And I think that's really important, because what we've picked up in this is that it can be a really emotionally turbulent time. We may neglect listening to our symptoms, how our symptoms are improving with HRT. So you're kind of there to hold our hands and to take us through that.
Yes, that's very important. And a lot of time, I don't want to prescribe HRT myself, because it costs you more money, and I don't want that. I really tailor approach for you. This is exactly what you can have a support from GP, because a lot of women don't know that. And then that way they save their money. But I am there to support them, like I supported Jay or other clients I do. I still support them with their GP journey. It's not like I tell them and make a lie to their GP. They have right. It's just what they say. They don't even explain their symptoms properly to GP, and GP doesn't know. So that's why. So, and then I support, and then they collect the medication. Then I'm still approaching them with their medication and journey, and for other approach as well. So I make a journey for them. That's very important as well for me.
So they can get so advocacy on how to access HRT with your GP.
Yeah.
Support when you start taking the HRT that is above what the GP practice can give you.
Yeah.
And if desired, if necessary, review and prescription via you, should it be necessary.
Yes, I do that.
And holistic support, lifestyle, future long-term planning. I love that. That's really important, because there's only so much that your GP that can do for you.
Yeah,
what a boom episode.
Yes, and it's very important you understand what's going on with your health, and you make a decision yourself. By having a right knowledge is very, very important. And as I always say, nothing is right and wrong. It's what right for you is very important. And also another thing, sometimes you say, I tried everything, nothing worked. Then it's my responsibility to find the missing piece, what is wrong, to make sure then we work on that.
Who's not in the band?
Yeah.
Where's the tambourine player? Let's find the band, the missing band member.
Yeah. What we need to, Yeah,
I
and what
love the way
music we
you give
make in
those.
there, and that's where we get the
Yeah, I love the way you
because
give those
it's
examples. I think it's brilliant. You know, yeah, a band needs to be fully staffed, fully whatever you
synchronized.
call it, or the home
Yeah,
decor. You could put a fancy sofa in, so you could pop the pill. But where's the rest of the things that make it the look, the feel, the energy?
yeah. Even if you want to play Bhangra music in opera, you still need to find the bandwidth where it will synchronize together. So that's how I see. But we make it too complex. We need to keep it simple, and that's how it is. We absorbing more information than implementation. That's where we're going wrong.
There's so much noise out there. Please get in touch with your
My
questions.
parcel is here. My parcel here. My parcel. I'm back.
I love that. More information than implementation.
So
You've
this,
got some great one-liners.
yes, yes. I need to make this thing. Yeah. So that's very, very important to highlight. So any questions you have, please drop us a message. From here, if you want to record or any other episode, we're happy to record. This came after the panorama. A lot of people asked us a question, so we will record. We had a good pause. Now we will be back to delivering you all our episodes, English, Punjabi, 2 topics a month. That's what we'll be doing.
It'd be good to see how we translate this in Punjabi. And you are welcome to listen to it if you do speak Punjabi, so you can laugh at me. But that's okay.
Thank you.
Thank you all. See you in the next episode in a week's time. Don't forget to share what did you think of this episode, and click subscribe, like, comment and share for updates on future new episodes.